Hello, everyone. So, how are you doing today? How is your summer going? Are you doing anything, fun on a regular basis? I know that, school started, but maybe on the weekends, are you choosing something fun? Even if it's small things, maybe it's a board game or, something. But do something fun because, fun is extremely healing for the body. So, today I wanted to talk to you about gallbladder surgeries or gallbladder removal. I know a lot of people who actually have their gallbladder removed. Do you know you can actually totally prevent that? That you don't need to get your gallbladder removed even if you have pain there. I just saw a patient who was pretty much told that he has to have his gallbladder removed, and this is not the first patient, obviously, but he was told that his gallbladder needs to be removed because he has gallstones and plenty of them as well, and there was no other option in conventional medicine other than removal of gallstone. But what we did for him is we did a protocol for him, and we were able to clean up all of his gallstones. They came out. Whatever your body makes, it can also remove. So, which meant that gallstones were made by the body. So, we were able to remove that. And now, even on ultrasound, he actually has less gallstones. So, it is not done in one time. We have to repeat the process in 3 months again to remove all of that. But all of his pain went away because gallstones typically are formed within the gallbladder, and then they go and sit in the bile duct. From the gallbladder to the small intestine, there is a small duct which is very thin, and whenever the gallstone that's formed in the gallbladder slowly moves onto the bile duct, it causes severe pain. And that is the reason why a lot of people who have serious, like, episodic pain have to go in to the ER and immediately get it removed. And so this patient was having not episodic pain, but he's been having pain, and that's usually the case. We typically have pain for a period of time, but we don't usually listen to the body, right? We are told that just suck it up and move on. Just live with it. I mean, if it's not really too bad, then just go on. If there is pain, just take a painkiller. And what we are told is to silence the body. And the more and more we silence the body, the louder and louder the scream gets from the body. And so in his case, he started having pain. A lot of people on the right side, they'll have pain, and that's an indicator, right side of their abdomen. They have pain, and that's an indicator of possible gallstones, and sometimes it could be the liver as well, but many times it's gallstones. So if you are someone complains of pain in the abdomen, ask them where it is. And if they tell you that it is on the right side of their abdomen, right below the ribs, then it's possible that you could go and get an ultrasound done and check and see if they have gallstones. If they have gallstones, then you can naturally treat it and remove it so that you do not have to have your gallbladder removed. Your gallbladder is extremely important for you. It's important that it stays. It's not a vestigial organ. That gallbladder, what it does is, even though people will tell you, it's okay if you didn't really have a gallbladder, it's not. Because what the gallbladder does is it stores bile, and this bile helps the digestion of fats. It also helps in stimulation of peristaltic movement in the colon to cause us to have bowel movements. It also makes the stool soft and rather formed and easy enough for it to pass and not really hard. So, and if you get your gallbladder removed, then it may be difficult for you to digest fats, and you can even have runny stools after your gallbladder is removed. So it's not something that you want to do. So if you can, you always want to prevent something from happening rather than treating it once the problem is already there, right? That is the best way to treat anything, is to prevent it. And so that's exactly what I'm telling you here. So if you or someone has pain, immediately go get an ultrasound done and see if you have gallstones. And if you have gallstones, find someone like us, find someone like me, and they would be able to help you treat it and get it removed from your body, and naturally, without having to go for a gallbladder surgery, which means that not only will you protect and prevent a surgery. You will protect your gallbladder, you will keep it intact, and that is going to help your digestive system function better. Otherwise, without a gallbladder, your digestive system definitely starts functioning poorly, and you do not want that at all. Okay, so in this patient, that's exactly what happened. I just did that, and since then he hasn't had any pain at all. But one of the things that happened with him that also made me think, okay, I need to kind of talk about this, is that so he stopped having pain and he started eating poorly again. So we have to ask, right? So do we have to always have pain or some kind of discomfort from our body to be able to eat healthy? I often tell people, why do you think I eat healthy? Not because I love eating healthy. Well, that is true. But that's only because I've eaten healthy for such a period of time that it's easy for me, and I've started loving it as well. But if let's say that I was told that I could eat, cakes and ice creams all day, every day, and eat whatever it is that isn't necessarily good for me, but I could eat all of that all the time and be healthy, don't you think that every one of us would choose that? So the reason why I eat healthy is because I want to stay on this side of the desk where I help people heal and not really need, to go to somebody else and, need help. So of course, we all need help from time to time, but I, would rather prevent so many things from happening than treat them. And that is my philosophy about health. So if your body is telling you something, listen to it. And try not to remove any organs, because there is really no value in removing something and you can't put it back once you remove it. But do everything you can to prevent that removal, because that's the language of the body and it's saying something to you by that pain, and removing something isn't going to help. The second example for that is another patient that I've been seeing, and she's been under a lot of emotional stress. And so she had uterine fibroids because there was guilt about child that she lost. And these kinds of things are energies that stays in our body. Our body has amazing memory, especially for the things that we are guilty about or that we feel horrible about. Body holds on to that memory, and that's the reason why it creates those emotions anytime we think of it. And she went ahead and removed her uterus, but then she actually developed heart disease later. So the thing is that again was an indicator that was something that needs to be healed. And since that wasn't something that she knew, she went ahead and removed it because that's what was given to her conventionally. That is the wisdom, right? Conventional wisdom is to remove the organs that causes problems, not really look at why you have the problems and uproot that problem. So in this case, that's what we find now. And of course, now she can't really remove her heart and she has to be on medications for the rest of her life. And now, she is obviously looking for other options. And then we started, uprooting those kinds of things and healing her heart disease. So it's amazing how our body is. It's amazing what it's trying to tell us. The only thing that we need to do, though, is pay attention. When we pay attention, we take notice, and not only take notice, but do something with it, we are going to be able to do amazing things with it. All right. So if you have any pain, think about what are the organs associated with that area. Like there are many organs that are associated with each and every part of your body. Even if it seems like it's appearing in your eye, the organ associated with that is liver. So you may have a problem in your eye, but really the cause is coming from the liver. And if you don't understand that, we will be treating the eyes and the problem won't go away. So, and the same way with joints, if you have problems in your joints, many times it's associated with your kidneys. And so if you don't really address the kidneys, your joint pain will not go away. So please, please, please understand this whole body is one. We do not have different organs in different countries. That's not how it works. So we have to take into consideration the whole body when we treat it. So ask the question, what is it that my body is trying to tell me? And if you cannot understand it, then go to someone else who can, and then uproot the problem. Do not put a band-aid. It doesn't work. It doesn't help. But keep your gallbladder safe, okay? And, eat lots